Hey, it's Adam Sewell, MD. Welcome to Section 4.2 of the Microplastics Toxicity Training, certified by the Microplastics Health Alliance. In this session, we're going to walk through how to take a high-yield, clinically actionable environmental exposure history that focuses on microplastics and plasticizer-related toxicity. If you've practiced long enough, you know that a good history will out-diagnose most labs. And when it comes to microplastics, a focused exposure history is often your first and most effective diagnostic tool. Part 1. Why the environmental history matters now more than ever. We are living in an age of unprecedented environmental exposure. Since the 1950s, global plastic production has skyrocketed, from around 2 million metric tons per year to over 400 million today. And unlike many other toxins, microplastics are ubiquitous, invisible, and internalized by nearly every human being on the planet. Most patients aren't aware of their exposure, and most physicians aren't trained to ask about it. That's where we step in. A proper microplastics exposure history helps us do three things: quantify exposure risk when labs are unavailable or cost prohibitive, build a personalized detox plan based on lifestyle and environmental behaviors, reinforce behavioral change by showing the patient exactly how their daily routine contributes to their burden. Part 2, the 5 Ps framework for microplastics exposure. To make this easier in clinic, I recommend using a simple but effective framework, the 5 Ps of microplastic exposure. These are plastic use, packaging, personal care, professional setting, and potables. Let's break it down. 1. Plastic use. How do they store and heat their food? Ask, do you regularly store food in plastic containers? Do you reheat food in plastic in the microwave? Do you use plastic wrap over hot food? Patients who microwave in plastic or pour hot food into plastic containers are at higher risk due to thermal shedding of microplastic particles and plasticizers like BPA and phthalates. Follow up. Do you use silicone, glass, or stainless steel as an alternative? 2. Packaging. How is their food delivered to them? Ask about pre-packaged meals, fast food, and takeout containers. Styrofoam and soft clamshell containers often leach chemicals into hot foods. Do you drink from plastic bottles daily? How often do you consume food that's been packaged in plastic? Follow up. Do you notice if the packaging says BPA-free? Do you know what type of plastic it is? 3. Personal care products. Ask, what kind of shampoo, lotion, or sunscreen do you use? Do you use any exfoliating scrubs or cosmetics with microbeads? Plastics and microbeads are common in exfoliants, toothpaste, and even feminine hygiene products. These offer direct dermal exposure. Phthalates and parabens are often hidden under fragrance or perfume on the ingredient label. 4. Professional exposure, occupational risk. Ask, do you work in healthcare, manufacturing, automotive, textiles, or cleaning industries? People in these fields may be chronically exposed to PVC tubing, plastic solvents, synthetic fibers, and volatile compounds used in industrial processes. Follow up. Are you regularly around melted plastic, dust from vinyl, or fumes from heated equipment? 5. Potables. What water do they drink? Ask, do you drink filtered tap water, bottled water, or well water? Do you use a filter, and if so, what kind? Studies show bottled water can contain 2 to 3 times more microplastic particles than tap water. Some home filters, like reverse osmosis or carbon block systems, can reduce exposure, but most patients don't know what they have. Part 3. The 2-minute microplastics exposure interview. In a busy clinic, time matters. That's why we've developed a rapid screening version of this history, which you can use during intake or as part of your new patient process. It's called the 2-minute microplastics exposure interview. Here are the 5 core questions. How do you usually store and heat your food? Do you drink from plastic bottles or use plastic cups daily? Do you eat a lot of takeout, prepackaged, or fast food? What kind of water filter do you use at home, if any? What kind of personal care products do you use? Do you check ingredient labels for parabens, phthalates, or microbeads? That's it. 5 questions, and you'd be amazed how much diagnostic data that gives you. You can document this in your EMR or use the downloadable intake template we've included with this training. Part 4. Incorporating the MHA Screening Tool into your workflow. Now, here's where this gets even more powerful. You don't have to rely solely on your memory or manual note-taking. The Microplastics Health Alliance, MHA, has created a structured clinical screening tool that your patients can complete online. As a physician, you can create a free MHA provider account. From your dashboard, you'll be able to send a secure, HIPAA-compliant link to your patient. They fill out the survey, usually in under 5 minutes, and both you and the patient receive the results instantly. The survey covers not only exposure history, but symptom clusters and lifestyle factors. It gives you a composite score that correlates with low, moderate, or high risk of microplastic toxicity. You can integrate this score into your diagnostic plan, your treatment initiation decision, or even use it for before and after tracking during detoxification programs. Best of all, it allows for consistent, repeatable screening across all of your patients. To summarize, taking a microplastic exposure history doesn't have to be complicated. Use the 5 Ps, plastic use, packaging, personal care, professional setting, and potables to guide your interview. Use the 2-minute Microplastics interview for fast intake and integrate the official MHA Screening Tool for structured documentation and scoring. This kind of exposure history is going to be foundational in preventive medicine going forward, just like family history, diet, and medications are today. In our next section, we'll take what we've learned and move into lab testing, looking at direct markers of microplastic exposure and indirect indicators of physiological burden. I'll see you in section 4.3.